He, along with other health officials, are expected to talk about long-term care facilities.
Good morning. Thank you for joining us on an important day
and
a very important mission for the state of Washington. Here in our state, we continue to mourn our lost loved ones, and we continue to thank the thousands of people who are working to slow this epidemic. And we'd like to thank actually 7 million Washingtonians, because Washingtonians are all pitching in on this. They're all being leaders in the things that we can all do to fight this epidemic. Now, Washingtonians are not going to work when they feel ill. They're washing their hands repeatedly. They're maintaining social distance as appropriate. Handshaking is so yesterday. We're now doing the elbow bump. And we are protecting our loved ones who are of a certain age or who have medical conditions, and remind them that this is not a time to be exposing themselves to large groups of people in confined spaces. I'm pleased that Washingtons, I think, are pitching in to do all of these things, and these are the most important things we can do, because our best weapon against this epidemic is smart individual decision making to reduce the interactions of people in which this transmission can occur. And so I want to just show my appreciation for Washingtonians being united on this in a common cause and realizing we're all in this together. As of last night, we've had 162 cases, presumptive cases, that in the preliminary test have been positive, and 22 deaths as a result of the virus. The virus is now expanded to 8 counties throughout the state of Washington, both in western and eastern Washington. Obviously, we continue to do all we can to protect all of our residents. Today, we're announcing some measures we're taking to help families who will have some economic dislocation or would otherwise have that dislocation, but for the measures we're taking to give those families additional economic security to deal with this issue. Today I'm joined by Susie Levine, Commissioner of our Employment Security Department, Franklin Plaistow, Assistant Director of State Human Resources, and Cheryl Strange, our Secretary of DSHS, Department of Social and Health Services. As you know, early this month I issued an emergency declaration directing state agencies to use all resources and explore all options to prepare for this epidemic. And one way to do this, and perhaps maybe the most important way to do this, is to protect our aged adults and those who have underlying medical conditions. So we want to address what we're doing today for our nursing homes and our long-term care facilities. The risk of severe illness and death from COVID-19 clearly is higher for members who are of our communities who are over 60 years of age and those with chronic health conditions. Fortunately, probably 80% of the people who have this virus will only have mild symptoms, but we know that this is a fatal disease all too frequently for those particularly of age and those who have chronic conditions. And we also know that an increased risk of rapid spread of COVID-19 among persons who are living in congregate settings, such as long-term care facilities, and most residents of long-term care facilities are at an increased risk of this virus. To that end, Secretary Cheryl Strange and I are urging compliance with the following in nursing homes and assisted living facilities, and these will be requirements. Number one, we are requiring compliance that residents are limited to 1 visitor per day. Visitors must be adults, and the visit must take place in the resident's room. This does not apply to end-of-life situations. Number 2, all visitors must follow COVID-19 screening and follow reasonable precautionary measures. Precautionary measures might include, but are not limited to, wearing personal protective equipment, social distancing, or visiting in designated locations. Number 3, all visitors must sign into the visitor's log, and owners and operators must retain that log for 30 days. Number 4, employers or volunteers must be screened, that's not testing, but screened for COVID-19 symptoms at the start of each shift. Number 5, people living in nursing homes or assisted living facilities who are under a recommendation or order of isolation or quarantine from the Department of Health or local health department must be isolated in their rooms away from other people. Number 6, owners, operators, staff, and volunteers are prohibited from disclosing protected and confidential health information except as otherwise provided by law or with the consent of the resident. We are doing this to protect our patients, obviously, their families, and people who care for them. We also know that when cases develop at these long-term care facilities, families and public clearly have lots of questions and high concern for their loved ones. Sometimes the real need for that information can overwhelm the staff's capacity to answer legitimate and important questions in a timely fashion. So the Aging and Long-Term Support Administration under our DSHS will contract with a case management entity that would work directly with facilities to provide real-time information to family members who are authorized to receive it. The administration will also have a web page ready early next week that could provide us up-to-date information as possible regarding these facilities. I believe this is going to substantially avoid the situation that we had in Kirkland with many families having such high anxiety about their loved ones. I do want to share with you that last night I spoke to Seema Verma, who's director of our Medicare and Medicaid entities federally, and she told me basically top-line results of the survey that the federal regulatory agency, this is the group that looks at the quality of care in these facilities, and she will have to release the survey when they can, but I can tell you in listening to her and when those survey results go out, I believe families will be comforted and reassured about the medical care that their loved ones have. It was very pleased to hear what I heard from the people who've gone in and actually look at the quality care of the nursing home. I want to talk about our unemployment insurance benefits. We are looking for multiple ways to give families confidence that they're going to be able to get through the hardship this has imposed. Commissioner Susie Levine is joining me today to announce new rules to help alleviate the economic impact felt by businesses and workers. We appreciate the businesses have already stepped up to accommodate workers who may be impacted by COVID-19. But I've asked Susie and directed our agency to look at all the things we can do to widen the safety net for people who are in this situation of either having illnesses or having to be isolated. Whether it's businesses expanding their paid and telework options or support for state workers, unemployment insurance or paid family and medical leave, we can help provide individuals with additional security while they care for themselves and their families. And I'm very proud of our state that we have probably the best security system for families regarding paid family leave and paid medical leave in the nation. In this case, certainly shows the wisdom of having been robust in those plans. So we can help businesses weather the outbreak and employees. And the Employment Security Department developed emergency rules that went into effect early this week. These rules enhance the flexibility of the unemployment insurance program to give high confidence that people can use this if in fact they're ill or isolated. The first and best option for an impacted worker is employer-sponsored paid sick leave under our state law, and I'm proud of that law. These additional rules are designed to provide a backstop for the vast majority of workers who do not have access to employer-sponsored paid leave, and they will help relieve the burden of temporary layoffs, isolation, or quarantine by ensuring unemployment benefits are available to individuals whose employment has been impacted by COVID-19. These new rules will ensure the following. Workers will be able to receive unemployment benefits, and employers will get relief of benefit charges if an employer needs to curtail their business or temporarily shut down operations due to these problems, or if because a worker becomes sick and other workers need to be isolated or quarantined as a result of the virus. If a worker falls seriously ill and is forced to quit, they may qualify for the paid family medical leave while ill under the existing program. Once recovered and available for work, they may apply for unemployment benefits. Next, we are providing leniency to businesses and individuals affected by COVID in their timeliness for financial penalties for late payments and information that is due. We're also allowing businesses using standby to include their part-time and less than full-time workers. I want to address our state employees. I'm also announcing steps today that will help those who work for the state and are impacted by COVID-19, including expansion of leave and telework options to all state employees. Franklin may have answered any questions you have specifically, but I'll go through this quickly. This morning I sent a letter to our state employees and I laid out these additional options. First, telework. State organizations will explore all possible options to expand telework to employees impacted by COVID-19. Next, we're expanding leave. State employees impacted by COVID-19 and required to self-quarantine or isolate under CDC guidelines will be permitted to stay home and pay if they're unable to telework for up to 14 days. Next, guidance around staying home and self-isolating. I will continue to ask State Human Resources to continue to monitor instances where our leave programs can support our employees and our families. I'm grateful for the fast action of our state agencies in responding to my emergency order. Together, these policies will help protect older workers, adults with problems, their families, and caregivers, as well as workers and businesses. Now, I just want to make a general comment. The suite of these policies are really going to help people weather this economically. And we're pleased to be able to expand this economic security net. But we have to realize we have a long road ahead of us. And we're going to be asking Washingtonians to step up to the plate to help all of our communities. And some of these things are going to require disruptions in our common way of doing business. And I just wanted to share with you and the public some information why those disruptions may be necessary. The best assessment we have from our epidemiologists, and we have spent hours and hours looking at the science on this because we're a science-based state from around the world. I've spoken from everyone from Anthony Fauci, the director of the National Institute of Allergies, Trevor Bedford, our excellent researcher at Fred Hutch, Dr. Bruce Alward, who's a senior advisor at the World Health Organization, and Dr. David Nabarro of the World Health Organization. We have searched the world for the best science on this. And I'm going to summarize what our state has been able to find. We have 162 presumed people whose test results have shown that they have the virus in Washington state. But unfortunately, since we haven't tested 7 million Washingtonians, we know that there are many, many other people today in Washington state who have the virus, who've not been diagnosed and may have no idea, may have no symptoms at this moment. And there is a range of that number, but the number I use is about 1,000, and it could be a lot more than that, frankly. Here's the problem and our mission. We need to look forward ahead of the curve in Washington state. If we're going to stop this epidemic or seriously slow it down, we need to look at what's coming in Washington state, not just as what is here today. Now, if we assume that there's 1,000 or more people who have the virus today, what the experts are telling us is that in an epidemic like this, looking at the characteristics of this virus, the number of people who are infected will double anywhere from 5 to 8 days. So the number of people who are infected in an epidemic like this will double in the state of Washington unless we take some real action here. And if you do the math, it gets very disturbing. When something doubles every day, it gets to a very large number very quickly. So if there are 1,000 people infected today, in 7 or 8 weeks, there could be 64,000 people infected in the state of Washington if we don't somehow slow down this epidemic. And the next week it'd be 120,000, and the next week it'd be 250,000. So this demonstrates why we have to consider all of us in our family activity, our individual activity, our institutions, that we need to take action today looking forward, and that's what we are doing. So with that, happy to stand for your questions.
Governor, many groups have followed the social distancing guidance and have canceled large events, but as you know, 30,000 Sounders fans were at a match in Seattle this Sunday. Other countries like Spain and Portugal are already moving to have soccer matches played in empty stadiums and broadcast. Referencing those numbers that you just cited about the doubling, shouldn't a policy like that also be considered at this time?
We are considering policies in that regard, and we're doing what we should do in consideration. We're looking at the most recent epidemiological research available, and I mean recent. We just found a new study yesterday afternoon pertinent to this issue. We are talking to the communities and leaders and public health experts, so we are considering those measures. I would not be shocked if we have some more news on that in the next few days.
Governor, can you just clarify that for a nursing home resident, one of the provisions in your proclamation says a resident can choose to discharge from a facility at any time. Is that referring to a resident that is not diagnosed with COVID-19, or could a resident who's been diagnosed with the virus still discharge at any time?
I'm Cheryl Strange, the Secretary for the Department of Social and Health Services. A resident can discharge at any time. There are a couple ways they can do that. They can receive a doctor's order to discharge. Some individuals may choose to discharge what we call against medical advice, in which they are going out against the doctor's desire. Again, our Home and Community Services division within DSHS has a transition team. We discharge patients and transition patients all the time. So they are free to do that, and we stand ready to support them with additional placement options. The challenge, of course, is finding additional placement options right now, but we are working on that.
Apply immediately to the residents of Life Care in any nursing home in the state if they wish to remove their parent, if the parent wants to leave today as we speak. Could that be done?
The answer's complex in the sense that we're in the middle of this incident and trying to manage it. There are a lot of guidelines. As Governor said, we are following the science. We have the CDC. We have the Centers for Medicare and Medicaid issuing almost daily guidance. The Department of Health is issuing new guidance following the Governor's executive proclamation here. So at this point, we are on a case-by-case basis. There are overriding requirements with all these things.
So let me add something to Jerry's question here for a minute. So if there is a person that creates a risk to other folks, either because they've tested positive or maybe even because they've been in contact, the state does have the authority to insist on isolation of those people if they do go to a different site. So far, we have not been required to make any orders. So far, virtually everyone who we've made requests has complied with that request. So I would anticipate that if there is someone, certainly if they're positive with COVID-19 in the facility and they'd like to go somewhere else, they're going to be advised to, wherever that is, to be a place where they can be isolated or quarantined. And you can anticipate that if they're not cooperative with that we do have the authority to require that. Like I said, Washingtonians have been extremely cooperative. Virtually everyone, almost everyone, has really complied with the request. So I'm not concerned about that. That's going to be taken care of.
Governor,
yeah.
Given the numbers that you just laid out in terms of the potential spread here, how can you afford to wait even one more day for mandatory policies around social distancing to try to not contain this anymore, but mitigate for it?
Well, we're doing everything in real time as rapidly as possible to make good decisions. And you don't want to make decisions where you haven't thought about the consequences. Shutting down any social activity has profound consequences in people's lives, and you have to understand those, and you have to see if there's ways to reduce them or ameliorate that. That's the work we're doing right now. And it is done with a sense of urgency that we feel, given these losses. We feel it so profoundly to lose 22 of our citizens. We know the stakes, but we need to understand the science fully, and we also need to have some communication with leaders in the community. I have extraordinary emergency authority in this regard, but if it's going to be followed, if it's going to be effective, we have to have some relationship with local communities and leadership, and that's why we're having conversations about this right now on this subject.
Just to help us look around the corner, is it likely that the local areas that are most affected would actually impose these requirements, or that they would come from the state? Would they be geographically limited or statewide? Would schools be included, not included?
So, as I said, I will not be shocked if these questions are all answered in very short order, but we have not made final decisions, and it could consider all of the things you just listed. Those are the kind of things that we're thinking through right now. There are multiple legal jurisdictions that do have authority to impose restrictions. The governor being first, or the most geographically dispersed. Local health officials also have authorities. Cities even have some authorities. So there are multiple authorities that could act. Obviously, I think that using the governor's authority may be the best from a statewide perspective. And I can just assure you we're considering those things right now.
You've used the number 64,000. There might be that many cases in 7 to 8 weeks. How many deaths do you anticipate?
So the mortality rate of this virus, there's not a precise number available to us, and probably won't be for years, if ever, because to figure out the mortality rate, you have to assume how many people had the virus, and sometimes that's hard to figure out because we don't test everyone. The information we have is that the World Health Organization and their experts have assigned a mortality rate of, I think it's 3.4% of the people who have the virus. Now, if in fact that is the mortality rate, and you have, you know, over 64,000 people infected, you've got maybe 1,900 fatalities just that week. And the next week, it doubles that. So this is a significant number of people who are potentially at risk if this continues to go. If the number is closer to 1% mortality rate, then you get numbers in the 600 range just that week. And whatever those numbers are, obviously those numbers are high enough that we need as a state to be bold on some of our actions at the right moment when we've been able to assess all the science. So I don't think we have the luxury of arguing whether it's 1% or 3%. It's too high at either one, and that level of fatalities is unacceptable. So that's where we're moving here.
It's a bit jarring, though, to, you know, we see like the band Pearl Jam has canceled its tour, and they live in Seattle. It's a bit jarring, some would say, just that people individually are having to make these decisions as opposed to government.
As I said, the government is going to make the right decision at the right time on the right science, and after talking to the right people to assure that whatever decisions are made actually can be implemented. And that's what we're doing today. Don't be surprised if we're back here in a day. George, you have a question?
I'm just curious, Secretary.
I'll get you in just a second.
I have a question also. Secretary Strange, about options for, you mentioned finding replacements for people for isolation or quarantine. What sort of options are you looking at here?
Again, Cheryl Strange, Secretary for the Department of Social and Health Services. Joe, we don't have any new miracle options. You know, we have a range of services. We serve about 125,000 individuals in our long-term care program. About 55,000 of those are served in the facilities that the governor is talking about today, our nursing homes and our ALs, our assisted living facilities. We've got another double that being seen and provided services in their own home with individual providers, agency providers in the long-term care system. So those are the options that we continue to have. We've got nursing homes, adult family homes, individual providers providing care. So our goal is to try to minimize the placement of people who do not need to be in a hospital level of care into those services as well. That's an area we're working on in transition. We have some people in community hospital beds, as you know, that we're working to get out. They are taking many of those slots as well, but we're trying to keep up here.
Governor, you had mentioned the 64,000 figure. Given the fact that if life care runs its course and the people there are dealt with, is there the potential that the numbers of deaths may not reflect the 64,000 and may not go up dramatically as a mathematician might project? And again, also, how is your health and have you been tested?
No, I haven't had the test. I feel great because I'm surrounded by a lot of people who are working hard on this, and I'm inspired by what I see around me. So I feel good about our working mission here. Look, all of the numbers that I've just shared with you are estimates, and there are wide ranges on the estimates. There's a wide range. It may be 2,000, it may be 500 as to the number of people infected, but I know that it is too many today, and that it is one that causes grave concern, because the one thing we do know is that there is a fairly predictable rate of spread, which is anywhere from every 5 or 8 days, these epidemics double of this particular epidemic. So whether it's 500 today or whether it's 1,500 or 2,000 today, that just goes to a very large number very, very quickly. So what happens in mid-May if this is not slowed in some fashion, it could be shorter than 60,000 by tens of thousands, or it could be a lot larger than 60,000 by tens of thousands. That's the closest range, kind of midpoint of what I have been able to ascertain talking to the epidemiologists. So you may have a discussion of, 5 epidemiologists, one who says, no, it'll only be 30,000, and another will say, no, it'll be 100,000 in mid-May. But that is not an argument worth having. It's just either one of those numbers indicates we need to move here. So that's the information we're making. I'm going to take 2 more questions. Yeah,
Governor, if you
maybe one more.
If you had a wish list of things that could either be done, or federal government, or National Guard, I mean, what would you ask for? What does the state need to potentially keep these numbers from growing as high as potentially they could?
Well, what we need, and I'm sorry if you've heard this before, but what we need is the most important people in the state of Washington, frankly, are not governors or senators. They're every individual in their family. Because the most powerful force to restrain this epidemic are the individual decisions of 7 million Washingtonians. And if I was going to ask for one thing, it's for everyone to get up in the morning and focus on their family and what they're going to do, but also think about what can I do to reduce the risk of this. And those things are the single most powerful weapon we have against this epidemic. And so far, I'm pretty pleased of what Washingtons are showing. They're teleworking in the droves. They largely are, to my knowledge, not going to work when they're sick. There's a lot of bumping of elbows going on instead of shaking of hands. Those are the big weapons against this epidemic. If I was going to pick a second thing, it would be a surge capacity for our medical system. If these numbers get anywhere close to what I've just talked about, we are going to have real challenges in our hospitals in being able to deal with very, very sick people. There are limitations on personnel that we're working through, and there's some concerns. We're trying to maximize the availability of ventilators, which is very important to people with severe respiratory problems. We have a plan where we have identified where those assets can be, but there's going to have to be some changes on how we run the system to maximize the efficiency of the assets, personnel and equipment that we do have. But I do believe we're well suited. The state now, for some period of time, has had a working plan to find and to implement those medical facilities and personnel. So with that, I want to thank you all. Take care.
Governor Inslee and other health officials just held a news conference concerning residential care facilities as well as employment disruptions and also the possibility of imposing orders to ban events. So the governor says to slow down the spread, the state needs to take real action, though he did fall short in enforcing orders to cancel big events. He says that even though we know there are 162 confirmed coronavirus cases, including 22 deaths, he estimates there there are probably closer to 1,000 today, and that the state can expect those numbers to continue to climb. And the governor, if you were listening there, did give out some startling numbers. He said experts say that we could see 64,000 cases in a matter of 8 weeks. He also says he does have the authority to impose canceling those big events, but he is weighing the science of whether that is the best option. He said we are searching the world for the best answers to respond to coronavirus. He also went on to say, do not be surprised if we are back here in a day with another announcement. In the meantime, there are new guidelines for nursing homes and long-term care facilities, and that includes limiting patients to one visitor, keeping a log of visitors, and screening healthcare workers at the start of their shifts. He also talked about unemployment benefits and the State Family Leave Act, adding that unemployment funds being made, currently being made available for those who are out sick, quarantined, or laid off because of this virus. King 5 is committed to bringing you the facts. It is our goal to get you the information in the best context that we can provide, and that is why we are dedicating an entire hour to answering your questions tomorrow. The town hall will be from 7 to 8 o'clock. We will also be on Facebook from 8 to 8:30. Until then, you can always get the latest information from us on the air and online at king5.com.